Hello, I'm exercising again. Sorry about my unshaven face. Let's see. That's gonna be better. Whoops. All right. So, I had a question in regards to anxiety and depression, and can family practice treat it? The answer, of course, is let's see. Sorry about that. The answer is, of course, we can treat it. Okay, so depression and anxiety. I tell people that depression and anxiety is a chemical imbalance in the neurochemicals in the brain. It can be genetic, so there can be a family history. It can be a primary or a secondary diagnosis, which means that you can have, for example, just as an example, you can have alcoholism with depression, you can have depression with alcoholism, you can have anxiety with underlying PTSD, etc. The most important thing about these diagnoses is getting them diagnosed correctly. The first part is getting into your regular physician, PCP, internist, etc., family practice, and getting diagnosed. There is some controversy in children and teenagers, as in the past, use of medications could increase the risk of suicidal tendencies. But what I can tell you is what we found is that not treating it can put people at just as much risk. So I think it's an individual basis. A couple chemicals that are involved are serotonin and norepinephrine. And what we believe is that when you're under stressful situations, like students in college, like moms, dads, etc., you use up your serotonin, which is your feel-good hormone, too quick, and then you're stuck because there's not enough of it left over. The cool thing about medicines for depression, of which people know, like Prozac, Zoloft, Celexa, is that it's not like you're taking Xanax or some other controlled agent. The medicines only prevent the breakdown of your own feel-good hormone, which means that if you take these medications, they're not addictive. They're only going to enhance your own neurochemicals. The other one is you don't have to take medicine. Some people are very open to counseling. The problem with counseling, if it's a problem, is that you have to do it quite often. Initially, you also have to find a counselor that you can work with, and that could be a problem. Sometimes it's hard to get personalities that fit. Bottom line is we use diagnostic criteria. You can look up on the internet something called the PHQ-9 for depression and the GAD-7 or the GAD-7. Those are two tools that you can use to diagnose depression. The other thing, of course, in students is you also want to look for secondary causes, medical causes. Medical causes would include stuff like thyroid, diabetes, anemia, and obviously in any teenage population or college population, we have to discuss drug use. In women, we always talk about pregnancy, and those are just questions that we talk about. Bottom line is it's treatable, it's curable. When I say curable, I mean typically 6 to 9 months of an initial treatment. Well over 50% of the people are successful with that and do not require medicine for long term. Bottom line, depression, I think in Montana, I think depression's a little bit like a, come on, work harder. Just get your head to the grindstone. Push, push, push. You know what, if you're depressed, you're depressed, and it's worse in the wintertime. So obviously vitamin D, sun can help. Bottom line, it's not a weakness. It's not an illness that like you get like a bug. It can go away. It can be severe though. I mean, it can be life-threatening. And suicide is real. So, suggestion is get to your doctor. If you think you have the criteria for depression, the true criteria for depression would be being run down or depressed or lacking any kind of want to do anything fun, over the last 2 weeks. Anxiety obviously is being anxious about things no matter what, and sometimes you don't even have to have a real cause. And in fact, if you have a significant cause, like say someone dies and you're depressed about it, well, that's something we call grief reaction. So a couple of the drugs that come up to mind that are very common: Zoloft, Celexa, Lexapro. Counseling, it would include a number of issues like cognitive behavioral therapy. Testing should be done. Lab panel is probably done to rule out medical causes, but we can get all these people treated. And it is what it is. It's no different than diabetes or hypertension. It's a chemical imbalance, and it needs to be addressed. All right, so get to your doctor. If you have further questions, ask down in the doobly-doo. I can go over the diagnostic criteria. I can go over in depth the medications, why they work, how they work, medicines that I think you should stay away from, other things you need to watch for, especially drugs and alcohol in the teenage population. And I'll continue to comment on this. Sorry about the shakiness of the video. I'm trying to combine all this so that I can get my workouts done. And by the way, exercise and diet are a huge component that we don't talk about enough, which means decreasing caffeine, decreasing nicotine, or avoiding it altogether. Exercise can increase serotonin levels. There's also natural supplements. One is called St. John's wort, but I would strongly suggest, instead of treating yourself or having a family member treat you, get to your doctor and see someone that you can talk to, because you're not alone. Oh my gosh. So many of my patients, probably in an average week, we see a lot of patients. A lot of patients in the US are seen weekly for depression, and it's not something that you have to suffer with. And they're stronger medications too. So bottom line is, take it easy. As always, get plenty of rest, drink plenty of fluids, avoid those toxins. As my wife would like to say, anti-inflammatory diet. Look that up. Regular exercise, at least 40 minutes, 5 times a week. And that's it. Have a great evening, and I'll see you later.